Good afternoon. I'm delighted to be here, and when they said, can you come tell us what Michigan is doing, boy, do we love to tell you. The Health Council has been around since the 40s, and we're a neutral convening body. So we don't ever do that ugly public policy stuff. We stay out of that. So because of that, we're able to put together collaboration, 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 and that's what we're about. And I'm going to talk just briefly about some of our programs, refer to some other ones, but what we're trying to do is do away with that everybody's got a silo. The AHEC's got a silo. The Rural Health Association's got a silo. The Center for Rural Health. We all work together, and I think you'll hear from some of when I explain some of our programs, that we've really done a good job of putting aside all of our differences, all of our little things, and working to get a result. Our first thing I want to talk about is our physician job placement. What these two previous speakers said is so true. There's a shortage. It's a difficult thing to recruit physicians, but we've built an infrastructure in Michigan that is incredible. We used to have, in the Upper Peninsula, we call it the Upper U.S., that a terrible time getting physicians to go up there. The companies used to charge them $20,000 just to put their name on a list. Today they recruit effectively. There are people who want that lifestyle. They want to go chase moose in the woods. They want to go up to Lake Superior. And it's a great place to live for them. But we've been up with Mom. We first had a bulletin board system, and so we have had the pain of rewriting our software 6 times for this system. The first one was wonderful. It worked from day one. All of our recruiters got together with us, with the Medical Society, with the Hospital Association, and we problem solved. The Health Council has run that for 18 years. And the 350,000 matches are just doctors. Now you think about the number of doctors, and we have 6,000 doctors training in our state in residencies, 6,000 give or take. So 350,000 matches is an incredible, they send their CV through the system to an employer. We also have Ohio as a very active partner. We've gone down there, and our program works every bit as effectively, and we recruit for rural and for large urban centers. So it's a great system. We also have a nursing job placement system. We've seen the change in nursing employment. The last couple of years, it's not so easy to find a job, so we've gone out and worked with home health. We've worked with long-term care. We keep saying, wait, just wait till these nurses leave their jobs and retire, and there'll be plenty of jobs. So we're keeping the system active. We know that it's going to be important in the future. We also have allied health placement. Gosh, we talk so much about doctors and nurses. What about OTs, PTs, clinical lab science? All of these are jobs that are needing to be filled, that our acute care and outpatient care are looking for. So we place those as well. And very successfully for our subscribers. We started a new program called the ACE Clinical Passport. Now this is entirely different from all the recruitment stuff I just talked about. But the recruitment systems are self-supporting. They support the council. And from that, we worked with the Michigan Health and Hospital Association. Southeast Michigan's 37 hospitals came together, Blue Cross Blue Shield, and the State of Michigan Department of Community Health. Some funded, some added board participation, but we built a clinical placement system that was developed by the Oregon Center for Nursing. We used that, but then we added to it something that we built that's a passport system that eases students into clinical rotations, and it does that. We have a learning environment, a very robust learning environment for OSHA, HIPAA, bloodborne pathogens, a number of other things. A testing mechanism for this. The students, after they test, that they can that they know all of this, then they move on, go to their school with a checklist of inoculations and all the other things that are requirements for clinical placements. So the hospitals and the schools don't have filing cabinets. We have it all electronically. If perhaps the student, and I can't tell you how many times this happens, doesn't do all those things, we have this annoying email that goes to them daily. You can't go to your placement until you do this. You can't go to your placement until you do this. So they arrive done. All the administrivia that we put into getting a student from an academic institution into a clinical rotation is on one system. We found some interesting things. There was one of these, whoops, we didn't know we were supposed to teach OSHA, HIPAA, and bloodborne pathogens. Oops, some of the faculty failed the test the first time. Those were learning things, but we have a hands-on committee of the regulatory people who look at this every year. We have a hands-on committee of the clinical nurse at the hospital who receives the students, and all of this is evaluated and worked on all the time. Our latest program is with MSearch, and I know most of you are probably familiar with MSearch grants coming from HRSA. Ours is a little different in that we have it automated. Our clinical rotations are on a database, and we have developed that. We've successfully sent students out, nurse practitioners, PAs, and physicians to start with, into underserved communities. And for some of our colleges, it's very difficult to get those students, undergraduate medical students this is, out into communities to have a different experience. Again, if you're going to look at living in a rural area, you have to be at one. You have to go to one. You have to understand the richness of that life and like it. So we've made that available to them, and it's been very successfully vetted, so we're now on the second iteration of that. Again, it's the state of Michigan that has the grant, our Department of Community Health. The Michigan Rural Health Association is fully cooperating. Primary Care Association is fully cooperating. The Health Council, of course, the Michigan State Medical Society, and all the colleges and universities. So we're right now in the process of building community projects for the students to go into a rural area and have a particular learning experience. Those community projects will be on different topics. We've gotten our local community foundations to express an interest in funding some development of curriculum for that. Some of the schools have said we're in. And so we're moving ahead on that. And I think it'll be it'll be interdisciplinary. We're asking that we rotate nurse practitioners, PAs, and physicians through, but soon we hope to add dental, social work, and the other health professions that also want to be recruited in the underserved areas. And we always talk rural, but we certainly have urban underserved as well. And that's one of our major issues in Michigan, is getting the students into urban areas where they learn the very different issues of new immigrant population, high density minority population. So that's something that is in the wings for us to do in the future. So I think what I would say to you is that we have made everything better for everyone because we've all worked together, because everyone has a share in this. And we've been able to put aside, when you think of 28 colleges of nursing saying, okay, we're in, we'll do it, and they are active participants in everything we do. Same with all the big hospital systems. They all of a sudden, we increased our clinical placements 21% the first year, and we did that a lot of it was peer pressure, because they all said to us before, we can't possibly take any more clinical placements. None, absolutely none. We're full. I don't know what you're going to do, but it's not here. And then they saw what the other hospitals were doing. They said, well, if we move on this way, we can do this. And a couple of them said, we're not doing our fair share. And so in a spirit of collegiality, they all came together and did it. So it was wonderful to see. And they all confessed their faults, too. It was really interesting. One said, we were way behind the 8 ball and in what we thought was a really big commitment. So I think there are a lot of things that this kind of collaborative atmosphere can bring about, and we're really proud of our programs, but again, we're really proud of what goes on in our state. So thank you for inviting me today.